Okay, Anna Brown is next. Anna Brown. Anna Brown, okay. We're moving on to Nicholas Volk. Nicholas Volk. Nicholas Volk, okay. June McDonald. June McDonald, number 83. June McDonald. Okay, you have 3 minutes. Okay, go ahead. You've got 3 minutes. You're welcome.
And councillors, I did prepare a talk and I had it down to 2.5 minutes. And I've just decided to get rid of the first page or so and just do a little preamble and then just read my last page, if that's okay. Now, I was born in Toronto Centre. I've lived probably half my life there. And one thing I've thought about listening to all these deputations is we're all talking about livability. And a lot of these issues that people are talking about, they care very passionately about because it makes the city livable. And it has an economic price tag on it. People come to Toronto because it's a livable country. My grandparents came here because it was a livable city. I think our livability may be in some jeopardy. And I look at this study and I think we're doing nickel and diming. This whole study, I don't see how you're going to get the money you want out of it. But we do provide one service in the city that is very expensive service, and we're not getting the money for it, nowhere near. So I have four probably rhetorical questions. I don't know the answers to them. I've been trying to find out. But if these questions are answered, we probably won't have too much of a financial problem, in my opinion. So, we know from our yearly tax bills how much the TTC costs us. Why are we not told how much private car transportation is costing us? I've asked this a lot. Nobody knows. We know we get about 6 cents a litre from the gas tax transferred from Queen's Park in Ottawa. Are these mere pennies a day sufficient to pay for the extensive services we provide? At least one report put the cost of policing specific to cars at 40% of the police budget. This is not Toronto. If true, we are spending about $300 million for car-related policing. If this is not correct, what are our policing costs for cars? What is the percentage of drivers from outside the city? Do they pay anything for the roads? Do we get any of the gas tax from them? These are questions I've been asking, and I don't know what the answers are. Thank you very much. Your 3 minutes is up. Okay.
Any questions? Minute to question. Seeing none, thank you very much. Thank you. Farah Khan, you have 3 minutes.
I'd like to thank Mayor Ford and the rest of the Executive Committee, as well as the councillors, for the opportunity to speak today on behalf of the Barbara Schleifer Commemorative Clinic. I'd also like to thank the other speakers that came before me. I've re-fallen in love with the city today, hearing their words and passion about this city. The clinic that I work for offers legal representation, professional counseling, and multilingual interpretation to women who experience violence. In the past fiscal year, our counseling department received 2,296 calls from women in distress. We were able to serve 61% of these women who called, but had to refer 39% of callers out because our wait lists were full. The demand for service is great, and it's increasing every year. I have the honor and privilege of facilitating the Open Trauma Group. Funding from the City of Toronto supports our Open Trauma Group, which serves women in immediate need. The program provides immediate access to support, information, resources, safety planning, and coping strategies for women who've experienced violence. The program fills a gap in service. Rather than have their name on a wait list and then wait for months for service or not receive service at all because the wait lists in the city are full, a woman who participates in the open trauma group receives immediate support. Immediate support is considered essential in the aftermath of trauma. Women who are not able to access their services may wind up in the hospital, in emergency wards, or worse. For them, it's super important that we have this program. Many women who make first contact with us, our clinic, through intake, and Elise, not her real name, was one of the women who called us in distress last summer. She shared with us that she felt ready to speak up at the sexual abuse she suffered as a child. She's not alone. In Canada, 1 in 3 girls and 1 in 7 boys experience child sexual abuse before the age of 12. We informed her that our waitlist was full, and we also understood from our networks that other waitlists in the city were full. Elise was desperate since she was beginning to remember the past abuse, and these memories were overwhelming. She stated that she was having constant nightmares, panic attacks, and flashbacks. She had considered suicide in the past. In the open trauma group, she was given concrete strategies to help her better manage her symptoms. She found great comfort and reassurance in the presence of other women who had similar experiences like her. Programs like ours are essential and important. The economic cost of violence against women is well known. According to Stats Canada, $11 billion is due to lost wages. We have private donors who work with us to match the city's funds. But without the city's support, we, and women like Elise, will lose a lot more than the small amount you suggest for cuts. I will have to find other work. Elise will have to find another port in the storm of her life. Indicators show that violence against...
Thank you very much. 3 minutes is up. Questions? 1 minute. Councillor Wong-Tam.
Thank you very much for your deputation. With respect to the oversubscribing of your service, what happens to the women who just don't get service at all?
What happens to them is oftentimes that they can either go back to an abuser, they can participate maybe and they can not be able to get counseling and support, which means they may have to use the hospital services, they may have to use the Gerstein Center, they may even do certain self-harm activities like thinking of committing suicide or actually committing suicide.
So if the city defunds organizations like Barbara Schleifer, we are actually putting these women back into abusive relationships, into abusive homes?
Yeah, and we're not just putting the women in abusive homes and back into those communities. We're also putting their children at risk, and we're putting the communities at risk because abuse doesn't just affect the women in the community, it affects everyone.
Has the violence ever led to death?
Yes, we lose women every year in Toronto due to violence from their partners.
That's 1 minute. Yes, Councillor Vaughan, 1 minute to ask questions.
Have you ever taken a look at the police stats on the length of time it takes to resolve an incident of domestic abuse and what impact that might have on the police budget?
I haven't. Can you tell me about that?
Well, I guess the studies that were presented to us, the Police Service Board, showed an extraordinary draw on police services when a situation arises because of the mandatory reporting component of it. And when there aren't services to take people to, what that does to the police service budget. But I'm curious as to whether or not your clinic has worked with the police to try to figure out a way to reduce police time by not spending on officers, but rather on social services that support women in the situation you're describing.
Absolutely, because we not only do work that is about after the violence, we do prevention work, right? And sometimes when women have experienced child sexual abuse, they can experience other forms of violence if they don't get the help they need at early interventions, because early interventions prevents other forms of violence from happening. So definitely we want to work more with the police.
Thank you very much.
Okay, so if police are a core service...
No, that's it. That's 1 minute.
All right,
Any other questions?
I forgot you changed the rules.
Questions? No? Okay. Thank you very much. Kate Hoffman?
Yes.
Okay, you've got 3 minutes.
Good evening. My name is Kate Hoffman, and I'm here as a business owner, a homeowner, a car owner, and a taxpayer, and of the City of Toronto. And I'm also a volunteer, a daughter of immigrants, and a wife. But the label that's most important to me is citizen. As a citizen, I'm here to tell you that I believe Toronto is made safer by the existence of community grants that the city provides, by the arts and culture programs and performers who are supported, by the public libraries that the city funds, by the public health programs that protect us all from communicable diseases and vulnerable populations, by the TTC services that operate late at night and early in the morning, and by the affordable housing that the city helps to build that alleviate pressure in this expensive housing market. Where KPMG sees opportunities for savings, I see investments in citizens. Toronto is a great place to live, in part because of these services, and I can say unequivocally that my friends and I would prefer to pay increased taxes and fees to preserve the city and the services within it. These services are the minimum that the city should be providing. As others have told you with specific examples, without CPIC grants, many organizations will not have the economic security to turn volunteer labor and provincial and federal program grants into programs that keep youth out of trouble. I volunteer at one such organization, and I can tell you that our staff have a lot of specific skills that are necessary to connect with marginalized youth, and we would not be able to do it without staff paid for by the City of Toronto. And our local expertise is equally not replicable by city staff. The centralized grants give us the security that we need to seek out other funds from other levels of government and from the private sector. Our public libraries are resources that give back far more value than they cost us as citizens. KPMG may only see the costs associated with staff and building maintenance, but I see the children and parents coming to learn and read together, newcomers being welcomed and oriented to their new city, small business owners getting affordable advice and research support. These are unquantifiable benefits because so many people use libraries every day. Late-night TTC service is similarly a service whose economic impact cannot be easily quantified. Working people rely on late-night transit service to get to work so that we can all be a globally competitive city. Not all of us can afford to drive and to park during our working days. The city's Affordable Housing Office provides a unique service that can't be easily transferred to another provider because they have developed the expertise about what the different requirements are, but aren't competing for the same funding as the city's housing corporation would be. If it were up to me, I would in fact reinstate the vehicle registration tax, toll the DVP and the Gardner, roads that I do use every single week, institute other progressive taxes and user fees on money-making ventures that use city spaces.
Thank you, Kate. Your 3 minutes is up.
Thank you.
Any questions? A minute? Seeing none, thank you very much.